It is my great pleasure now to introduce Vani. Kasia was able to introduce Narissa from Canberra. I get to introduce Vani from Wollongong. Vani works as a clinical nurse consultant in aged care at Wollongong Hospital. She's been nursing for 22 years. She's also a brave PhD candidate and very passionate about improving the quality and safety of older people in hospital. In fact, she is making a difference to the quality and safety of older people in hospital. She's been recognised and received multiple awards, both local and state level, in her role in aged care, including the New South Wales Premier's Award in World Class Customer Care. So Vani, please share your story with us today. Thank you.
Thank you, Vicky. Thanks, everyone. It's quite inspiring to listen to everyone. I will try to keep up with the expectation. I didn't get a chance to prepare a beautiful presentation. Sorry about that. I'm just going to share what's in my heart today and just tell you my story, basically. And thanks, Professor Victoria Trainer, for the opportunity, and thanks to GANA as well. It's such a great opportunity for the gerontological nursing profession to come together and support the future generation. So I'm really glad to be here. So my journey, as Vicky said, I've been working for the last 22 years as a nurse, and I worked in different specialty. And I even worked as a pediatric nurse, neonatal ICU nurse for 5 years before starting my career as an aged care nurse. I'm just in the other end of the, I guess, age group now. My interest to be an aged care nurse really started from my grandmother, my grandparents. Culturally, the grandparents lived with us. So I had an opportunity to look after my grandparents. And I also had an opportunity to be nurtured and supported by them while I was growing up as well. And I've seen the trouble they've gone through to look after the future generation, or the contribution they've given to the society as well. So when I decided to be an aged care nurse, I worked in nursing homes as well as acute care setting as well. So when I decided to be an aged care nurse, I went and did post-graduation. So I've completed 2 grad certs. Both are in aged care specialty. And then I went in to do my master's, and I was very close to finish off my master's. I think I've had 1 subject left when Vicky tapped on my shoulder and said, "Do you want to do Masters of Philosophy?" And so I ended up in switching to philosophy and Masters of Philosophy, and then now I'm a brave PhD candidate. And I should really thank my supervisors, Professor Val Wilson and Vicky, as well. So again, going back to my journey as a nurse, as an aged care nurse, I work as an aged care nurse consultant at Wollongong Hospital at the moment. And every day in my journey, I get the opportunity to spend time with people, with older people and their carers. So I think it's very crucial to be offering that support when in their difficult times. And I get so much of a job satisfaction, as Kasia, somebody said in previously, that it's a job satisfaction that I get working as an aged care nurse. And I also teach nurses on the wards, and I teach medical officers, and I contribute to the service planning for the aged care in Illawarra. So I think I was one of the really opportunistic or lucky people to be able to enjoy the research world as well as a clinician to be working in the aged care sector and in acute care as well. And most of my work is through collaboration. So it's, and I do believe that with aged care, it's not a one-man show. Like I collaborate with other CNCs or other specialties and allied health staff all the time, like pretty much every day, to be able to offer that comprehensive care to older people in hospital. And I'm very proud to be a part of their journey from the admission, and sometimes I do follow up in the community as well, most of the time. So then I see them coming back into the hospital. So you develop a relationship with what we call, I'm sorry, I'm so used to call patients, but people, really, when they come back to the hospital again, then they're like, oh, okay, hello, how are you? Like it's like a very friendly relationship. And it's most rewarding. It is most rewarding to be an aged care clinician. Um, that's pretty much really my journey. And as Vicky mentioned earlier, I've been very fortunate to be recognized for my work. And I think one of my greatest achievements that I feel is that are being recognized as providing the world-class customer care for older people in hospital. And also a couple of times I've been nominated for the extraordinary care to older people and carer in the hospital and in the community. And those, it's not about the award, but it's about the recognition of an aged care nurse for their work. And I do genuinely dedicate that to the hardworking nurses on the ward, because I do go and do some extra shifts and work on the floor as well when I get an opportunity to be one of the nurses on the floor as well. And I see the struggles they go through. And I often tell them, I just sit with them and tell them, aged care is a specialty. You should be very proud to be working in an aged care. It's not like people say it's not sexy. It is sexy. It can be sexy if you think it is. And it's a specialty. And that's where we need to be working towards empowering and supporting the aged care nurses to believe that it's a specialty, and believe that they are making a impact and change wherever they work, whether they're in acute care or whether they work in nursing home. So that's my journey, and I'm really, really proud. And I do thank all the people who supported me throughout my career, my journey until now. So I'm really thankful to all of them as well. Thank you.
Vani, thank you so much for sharing your story. I'm so happy you were able to share that today. Some of you may have seen Vani, she was one of our showcase nurses in lead up to International Nurses Day this year as well. So Vani, it's really wonderful to hear the work you're doing, and also to demonstrate that aged care is that wide breadth of nursing. It's not, sometimes people think of it as being nursing homework, but as Kasia said at the beginning, it's very important in the acute sector as well.
Sorry, I didn't add my PhD journey, obviously, but my PhD is looking at improving the quality and safety of older people in hospital. And I'm particularly looking at two geriatric syndrome. One is falls, which is a huge issue, as everybody knows. And the other one is improving the pain assessment and management in older people with cognitive impairment as well. So those are two very close to heart, passionate topics that I'm working on as a part of my PhD, as well as in the clinical area as well. Thank you.
Yes, and the knowledge translation projects, action research projects, where Vani is actually making a difference. She's improving the quality and safety in the hospital experience for older people.